All right, so doctors, we are glad you are spending your time with us to study, and today we are going to get into acute abdominal pain in children. Acute abdominal pain in children. And I want to welcome you. And as we do in MedCognito, we're going to start with the rationale for this particular class. So abdominal pain is a common presentation in children. And you know, I always say that common things are common, right? So in your exam, whenever you see something which you are told is common, that means that you need to pay attention to it. Okay. So doctors, in your exam, whenever you see anything which we are told is common, that means you need to pay attention, particular attention to that particular thing. So abdominal pain in children is something you need to master. While the symptoms may result from serious abdominal pathology, okay, in a large proportion of cases, an identifiable organic cause is not found. So that is good news. So what it is saying is that in a lot of cases of abdominal pain in children, you may not see an identifiable organic cause. And you realize that that is what is going to inform my topic for tonight. When a cause is identified, the cause is often age dependent. So if I were you, this is something I'll do. I'll ask myself, what are the common age-dependent causes of abdominal pain? So what are the common causes of abdominal pain in newly born infants? In infants who are above 3 months, but less than 3 years. In infants who are 3 years to, that's how you should start learning. Okay, good. Now, let's move on. Causal conditions. Remember that the objective is saying that many of the causes of abdominal pain in children, they don't have an identifiable organic cause, right? But what are the causal conditions? Low abdominal pain, like appendicitis, and we did appendicitis recently. Constipation, gynecologic issues. So if I were you and I'm learning this, what I would do is abdominal pain in children. What are the topics I need to master? Number 1, appendicitis. Number 2, constipation in children. Number 3, gynecological concerns in children. So for example, what are some of the things which can have gynecological implications in a girl? Ovarian torsion. Always remember that when you are learning, learn the things which can kill the patient first. Ovarian torsion, because they can have ovarian cyst and ovarian torsion. Appendicitis is very critical. Even children with imperforate hymen, children with, UTI, because UTI in children can present in a very bizarre way, right? Then I can also come to flank pain. So like pyelonephritis, kidney stones. So how do kidney stones present in children? How does pyelonephritis present in children? Epigastric pain, like gastroesophageal reflux disease, okay? Then generalized diffuse pain, like functional abdominal pain, infantile colic, and malabsorption. Do you know why I highlighted the infantile colic? It is because the objective said abdominal pain is a common presentation in children, while the symptoms may result from a serious abdominal pathology. In a large proportion of cases, an identifiable organic cause is not found. And one thing I've realized is that infantile colic is one of those ones. So the rationale and the causal conditions should teach me that, look, Dr. Brony, if you are preparing for this exam, when you are learning the cause of abdominal pain in children, also pay particular attention to those causes of abdominal pain which do not have an identifiable organic cause, and infantile colic is one of them. I used the rationale to help me to break down the causal conditions. Infantile colic should be one of those conditions I should pay attention to. The key objectives. So given a pediatric patient with abdominal pain, the candidate will diagnose the cause, severity, and complications, and initiate an appropriate management plan. So every single one of those conditions, gynecological conditions, appendicitis, constipation, colic, malabsorption, I must know the cause. Is there a severity rating scale for that? What are the complications? And what is the management plan for each of these conditions? Part of the enabling objective is that given a pediatric patient with abdominal pain, the candidate will list and interpret critical findings including those derived from a detailed history, including characteristics of the pain, an appropriate physical exam, including general abdominal exam, then special maneuvers if relevant, like rebound tenderness, shifting dullness, rectal, genitourinary, and other system examinations if relevant, and the identification of causes of abdominal pain requiring a surgical procedure. So all those abdominal pain stuff that we talked about, which of them will need surgery? I should know them as well. Okay. And the differentiation of possible psychological causes of or psychosocial circumstances in case of chronic abdominal pain. So now we are getting into some deep waters. Then list and interpret critical investigations, including laboratory investigations, diagnostic imaging, okay, and construct an effective initial management plan, including the determining whether emergency intervention is required and determining appropriate medical, surgical, and non-pharmacologic management for common causes of abdominal pain based on age. Then determining whether specialized care and or further investigations are required, like endoscopy, and recognizing possible underlying psychosocial issues leading to the abdominal pain.